Across the U.S., plastic surgeons' offices are seeing a wave of phone calls from worried patients.
Patients are calling the office because they're concerned that they may have PIP implants.
Although all the action from the PIP breast implant crisis had been overseas, surgeons are wondering what actually happened and what should they be telling patients when they call. Dr. Caroline Glicksman, a board-certified plastic surgeon in New Jersey and breast implant expert, says the French breast implant company was filling breast implants with illegal filler.
These gel implants were sold mainly in Europe and South America since about 2001 and were unfortunately filled with an industrial-grade silicone, which may possibly lead to a weakening of the implant shells.
Dr. Bill Adams, a board-certified plastic surgeon in Dallas who specializes in breast augmentation, says there's no need to be concerned because the PIP implants were never sold here in the U.S.
So luckily, most U.S. patients do not need to be concerned about these implants because the PIP silicone implants were never used here in the United States.
Dr. Glicksman says the scandal should be a learning experience for women here in the U.S. who travel to other countries searching for less expensive plastic surgery.
Price is still the biggest selling point for cosmetic surgery tourism, but you may be taking unnecessary risks with products or devices that haven't been proven safe and effective.
The fallout has been global. In Europe and South America, women have been lining up at medical clinics and hospitals to have their PIP implants removed. Even more alarming are questions surrounding the type of silicone used in the PIP implants. PIP's founder, Jean-Claude Mas, was arrested and charged in France with causing involuntary injuries. In order to cut costs, Mas was making the implants with non-medical silicone that could cause potential health problems. Many have asked, how did the French company get approval? Dr. Patrick Malucci, a breast implant expert in the UK, says it's easier to get approval in Europe, and there is not much ongoing oversight.
In Europe, we have what's known as a CE mark, which is a label of industrial approval. Now, I think it's pretty much the equivalent to your FDA approval, except for, I think to get a CE approval is much easier than getting an FDA approval equivalent. And so what seems to have happened with PIP is that they got their CE approval, and then essentially having got the CE approval, they discarded all the good stuff and started filling them with the illegal non-medical grade silicone.
It's estimated that 400,000 women in more than 65 countries are impacted by the scandal. U.S. experts are seeing an increasing number of inquiries from patients, and they recommend patients first determine what implants they have.
Most of the time, patients are given an ID card after the surgery that identifies the name of their surgeon and the manufacturer of their implants, and you should check to see if you have this card.
If a patient determines that they are PIP implants, they need to see a board-certified plastic surgeon.
There are a small number of U.S. patients who have their surgeries abroad. Those patients are a different subset. If a patient does not know if they have a specific implant type, they really need to contact the person that did the surgery to determine that. If they can't determine it, they need to see a board-certified plastic surgeon here to get recommendations. And if I'm seeing a patient who has a PIP silicone implant, I'm probably going to recommend that patient seriously considers removing the implant and replacing it to a known device.
For the Plastic Surgery Channel, I'm Jim Curtis.